All right, we are entering the final stretch here, and I'll say a few things after we're done with things to close us out, but we have one very important thing to do next, which is our closing plenary. This is one of those plenaries that also has come together kind of in a dream for me. And I'm really excited because the subject is going to be on perseverance, and I'm not going to steal his comment, but Bruce has a wonderful insight about this as the last session, so I'll leave that to him. But I'm going to introduce to you Bruce Compton, who will moderate this session. He's the head of the International Outreach Office, wow, I just butchered that, with the Catholic Health Association of the United States. And he's going to be joined up here by Father John Varghese from the St. John's Medical College in Bangalore, India, V. Chitamberi from the Zimbabwe Association of Christian Hospitals, and Justin Narducci, who is the CEO of Cure Hospital. So I will ask them to please come up, and I think, Bruce, over to you. We are supposed to do the message from John Nkengasong before I do that. Wow, I just jumped over a major protocol point there. Before we get to that really important plenary conversation, we're going to have a greeting from Ambassador John Nkengasong. Thank you, everybody, for keeping me on script. Apparently, I deviated. So John Nkengasong is, as you can see, the U.S. Global AIDS Coordinator. The office is the Office of the Global AIDS Coordinator, but we call it the head of the PEPFAR program. And so please, we'll listen now to this greeting from John Nkengasong.
I want to start by thanking you for your partnership and strong support for PEPFAR over the last 20 years. PEPFAR has been an unprecedented success story in saving more than 25 million lives across the world, mainly in sub-Saharan Africa, and in preventing infections in children and ensuring that they are born free of HIV/AIDS, and in excess of about 5 million over the last 20 years. When I met with President Bush in September last year, I was impressed by his commitment to bring HIV/AIDS to an end. I was equally impressed by how he committed himself and believed in the struggle against HIV/AIDS, and which was, as he said, I believe in God, and for a country that much has been given, much is required. That same determination is what is required of all of us in partnership with faith-based organizations to bring HIV/AIDS to an end as a public health threat in 7 short years. Faith-based organizations have played a critical role in the fight against HIV/AIDS ever since the start. Faith-based organizations were around when there were no treatment for HIV patients, where diagnosis for HIV/AIDS was equivalent to a death sentence. But faith-based organizations were around to provide care for patients and their families. Faith-based organizations were around when ARV drugs became accessible, in rolling them out in communities and ensuring that people even in the very remote areas living in the periphery had access to HIV/AIDS treatment. I want to continue to believe that this partnership will continue with PEPFAR as we journey towards 2030. Faith-based organizations are the voice of the voiceless in communities where access to healthcare is very limited. As a child, growing up in my country of birth, Cameroon, I witnessed firsthand where the country was challenged with an outbreak of trypanosomiasis, a disease that causes sleeping sickness, and how faith-based organizations played a critical role in vaccinating people, including myself, at that young age. And that couldn't have been possible without the trust that faith-based organizations bring into the community. Without the trust that faith-based organizations bring to governments, and without the trust that faith-based organizations bring to the donor communities. I truly look forward to a strong partnership with faith-based organizations as we journey towards 2030. I thank you for the opportunity to contribute.
That was terrific. And so now, with that behind me, now I am pleased to introduce Bruce Compton. Please come forward in the panel. And Bruce, I'll now actually really do turn it over to you. Do we need to move this a little bit? It seems like we're, yeah, you can take that.
Well, thank you, Doug, for that introduction. And I think what the ambassador was saying is that we all persevere. And Doug alluded to, I had something to say, and that is, I think we could probably end this session now because you're all here and you persevered with us to the very end. So you obviously understand this topic. It's wonderful to be here. I was recently in Ukraine and with the Catholic Church and the Catholic Response for Ukraine. And one of the things I heard the Monsignor, who's the liaison to the WHO for the Vatican, say more than once was the church was here before, the church is here now, and the church is going to be here after. And that's perseverance. And that's our topic today. I'm really happy to be joined by Father John V. and Justin, who Doug introduced earlier, to talk about this topic and to get them to give us some insights. Since we've already had the introductions, I think we'll just get right into it. Leadership, as the brochure says, requires specific strengths, such as those long-lasting relationships, relationship building, innovation, decision-making. There are some people that lurk at the church and think that's not us. But again, we have persevered. So I'm going to ask you to answer these questions. I've asked them if they have a comment to make it more interactive, to talk amongst one another a little bit and to not interrupt, but to really have this be a conversation. So the first question for each of the panelists, and we'll start with you, V, is these past few years have come with a lot of struggles. Can you share with us how you practically define perseverance? What does it mean in your context? And how does your faith integrate with that work of perseverance in your life?
Thank you very much. In my own experience, when I look at perseverance, it's like dealing with a lot of issues. And if you look at the definition of perseverance and other synonyms of perseverance, you find that it talks about a lot of things: integrity, confidence, etc., etc. So when we experienced COVID for the first time, as a leader in the organization, I felt like I was a sitting duck with a lot of things going underneath, but not knowing what will pull you down or whether you'll survive. And then also to say maybe do a flight, then you fly off and be in a safe space. But what has happened in the past, we realized that in terms of perseverance, you cannot work alone. We need other people to guide you and direct you, and also to give you confidence to move forward. So when I look at the situation when we started with COVID, the first thing I heard about COVID was, oh my God. And that was the first thing. And then the next thing is like family. Then the next thing is the workforce, because people are asking you questions, the institutions, government, stakeholders, and so forth. So in terms of that, it actually gave us confidence to calm down and think strategically to move forward. and then to have the faith and hope that as we work together, at least I might not fail alone, but if I fail, somebody will pick the pieces or help me to move on. So perseverance is very wide. You cannot streamline it to one sentence or one direction, but it's encompassing a lot of things depending on your environment, the situation you are, and also depending on the support which you get in terms of moving forward. So my perseverance is being strong, confident, also having the integrity to actually work with others in an open and transparent way. Maybe I'll ask my colleagues also to add in their own perspective so that at least we can share those experiences. Thank you.
Well, as you all must know that India was perhaps one of the countries which is badly affected by COVID, and we had to face a lot of challenges. In my hospital, which has got 1,800 beds, we had nearly 1,000 COVID patients at a time, and nearly some 15-20 ambulances waiting in line to hand over their patients to the emergency department. So we were surprised and shockingly shocked to know that we have come close to COVID and we have to accept patients. In fact, we are the first in the Bangalore city to accept a COVID patient. Not the government hospitals were prepared by that time. But what happened was many of our doctors and nurses volunteered and said, we have to take. This institution has always been in the forefront to fight epidemics or pandemics like this. Therefore, there's no question of turning back. We are going to accept them. And then my role was kind of leadership what Joshua gave to the people of Israel to coordinate them into different teams, organize them and so on, because everybody was volunteering to give the service. So the question was to organize and share, divide the responsibilities among them. So I must say perseverance was most to trust in God and then give everything. Whatever the resources the institution had, we had to give it to everybody, whoever wants to get them, because people could not pay, people didn't have anybody to take care of them, families could not be with them, or even at the point of discharge, there were nobody to come and take them home. Some of the family members were infected and staying back at home, or quarantine restrictions and so on. So we had to play all those roles, and just trusting in God, all we did. And it was mostly just to lead them, going around, meeting people, organizing everyday meetings, follow up with things, and then trust in God, because we were not aware about what next. So the question always was what next, how to do, how to go about. And we were always looking for insight and inspiration that turned out to be blessing for us, that people in all different aspects brought out good ideas, good methodologies, and then we could manage.
So I began Cure 3 years ago, which was right at the beginning of the pandemic. And for those of you who don't know, we operate children's hospitals, but they're elective surgery. It's not emergent care like that. And so I started, and the first meeting I had was with a COVID task force. And the COVID task force was deciding if we're closing the hospitals or not. There's 7 of them at the time. And so we were meeting together, discussing the pros and cons. And at that time, it was pretty unclear what the Ministry of Health would require of the hospitals. Should they become emergency care facilities and have ventilators and all those things that we don't have? Or should they just shut down and healthcare workers be deployed to other hospitals and those sorts of things? And so it was pretty messy. I mean, we had to come together. And I think this verse kept coming to mind as we work through this, which is the first chapter of James. Consider it pure joy, my brothers, when you face trials of many kinds, for you know that the testing of your faith develops perseverance, and perseverance must finish its work in order for you to become mature and complete. And I think as leaders, the word when is pretty important. It's not if you have trials of many kinds, it's when you have trials of many kinds. And I feel every day there's always a trial that we're facing, and the more that we expect those trials to come, the easier it is to work through them. So for us in that time, thinking back to the COVID time, We did establish a task force, which I know is kind of the next question. And I think task force are really important. Do you guys know what a task force is? Can you raise your hand if you know what a task force is? That's a nice way. Okay. So for those of you who don't, it's basically a cross-functional team that comes together for a specific time and a specific purpose, right? So it's not forever. And usually it's people from different parts of an organization coming together to make decisions quickly. And task forces are a great way to manage a crisis situation like this because you're getting voices from everyone and then you can make decisions and then they can cascade those messages through the organization. So I'm a big fan of task forces. What we did with the task force was essentially decide that we are going to continue to provide surgical care as long as we could. So basically until we got shut down or until all of our healthcare workers became ill or whatever sort of condition it happened. And those are very difficult decisions. And I think a lot of us make very difficult decisions every day. The COVID pandemic obviously exacerbated that as we tried to work through daily existence type of questions because you're thinking about so many things. And I know for all of us who have a lot of staff that are part of our teams, it's sort of, if you furlough people, where do they go? And if you furlough 1,000 people, do they get paid? And if they don't, then you start putting those things together and it gets pretty difficult to make those decisions. We did decide to stay open and we were able to provide surgical care for 20,000 kids throughout the pandemic, which is really incredible for our hospital team to come together and be able to do that. And quite frankly, we don't know what would have happened to those kids if we didn't. So I think the healthcare workers in our institutions are incredible. They're saints. They're hardworking, and if you give them the choice of engaging or not, or stepping back, I think they're all going to choose to persevere and move forward in the institution.
Thank you all for that. You all alluded to COVID, and Justin, you talked a little bit about how you were agile and creating a task force. But one of the best things that COVID taught us was that we have to be agile. If we all insisted on business as usual, we wonder if we'd even be here still today in these positions. In your organizations, can you give an example where you adapted to those changing circumstances without losing sight of your core goals? And what were the signs that you saw or that really gave you made you aware of that need to make those changes? And how did your team make it happen? Father John, you want to take this one first?
Yeah, well, the motto of our institution is, "He shall live because of me." And that itself was a great inspiration for us. Actually, we kept on saying this every day in our prayers also. So the situation was that we were running short of resources because when the number of COVID patients increased, the non-COVID patients decreased. And the revenue was badly affected. We are not getting much of revenue. We had to accept patients from the government centers, and they were not at all paying. And the government promised that they would pay. Still, we are yet to get some money from the government. So that is the situation. So the non-paying patients were many. But for that reason, we can't deny them care at all. And we never denied anyone. So we continued to give them good care, and we had to engage people to give this kind of care. So we openly told our employees that we are going to run short of resources. If people want to donate, you are most welcome. And some of them even gave their full month's salary to the organization. Some of them started circulating this message outside that our alumni started contributing to the institution. They gave us food materials, they gave us medical supplies and many other things. By the time we started getting from other organizations also during the second wave of COVID, many things like gloves, sanitizers, or other hygiene items and so on. So we were on the receiving side, but on the other side, we were not at all insisting on any payments or anything. So when we realized that when we were more liberally giving people, God was liberally giving us also. Then many of other organizations in Bangalore came to know that we are the most trusted organization for this kind of a care. Because many of those small private hospitals which were almost shut down or at the verge of shutdown suddenly rose up, started opening all their beds into critical care beds. And we know what kind of care they can give because they didn't even have staff. But they were charging so much and people were dying in such facilities. On the other side, the general public realized that we can trust this mission hospital. Not only St. John's, other mission hospitals also got the same kind of experience. The trusted hands for healthcare are the mission hospitals. That realization made people to help us very generously. Many organizations came out with CSR funds in terms of equipment we want for oxygen supply or even other devices, ventilators. Whatever we wanted, people gave us very generously. And therefore, we were on one side holding on to our values and ethics, and then generously supporting people. And there are many non-Christian organizations also which trusted and promoted our service by giving us generously whatever they could, even to support some of the employees at the lowest grade also. They gave food items, transportation facilities, and so many things like that. So I think being agile and adaptive really made us survive in a situation like this.
Thank you. V, and for your association.
Thank you. I think for our association, when we're hit with COVID, we realized that you cannot address the situation on your own. And also we had to deal with the virus structures in the country in terms of working with our church leaders, because they are the owners of our institutions. We had to work with government in terms of the country policies. We had to work with international partners, where we had to reach out to see if there are any resources which were coming into the country to help us. We had to work with other political structures within the communities, where we find that community leaders, church leaders, traditional leaders had to be informed about certain situations because communication was vital, and we didn't have communication. We didn't have answers. The whole global world had no answers. We didn't have vaccinations. We didn't have any form of resources for interventions. So for us to be very agile, we now reached out to some of these sectors where we are asking the faith leaders to say, is there anything or resources which you can give us to give to the institutions? In some instances, they didn't have. Then we said, now, what else can we do? Then we reached out to our regional partners and our membership to say, what are you doing in your country? So that at least we can put our heads together and make sure that we provide first the communication, the messages, because the media was full of all sorts of things, and we wanted something which was concrete to allay the fears of the communities. So we reached out to Archab, Charles, and other members of the CHAS to say, what messages are you sending out? Even Chuck, to say what messages are. So when they gave us what their countries have developed, we also assimilated those messages to our own whilst we're waiting for the government to come up with concrete instructions or policies to guide the country. We didn't have any PPE because our country was not manufacturing PPE. We now had to reach to our international partners because we knew that PPP. CCIH came up with something. Brothers Foundation, which is based in Iowa, Ohio, they sent us something. So they sent containers as a mitigation strategy for us to actually do something. But internally also, we reached out to our institutions to say, let's practice infection control whilst people are telling us how to deal with this situation. So we started making sure that people practice infection control to the T, making sure that the institutions are clean, disinfected, that patients are screened before entry. So once you were in that panic mood, You also had to come up with something constructive to make sure that you are protected, your workers are protected, government, our facilities are protected, and the communities. Because the communities in the rural areas were asking questions and we didn't have answers. So we started printing our own pamphlets before government started printing our pamphlets, and we're distributing. We started training people on infection control so that at least people are informed. So agility comes into play because you have to be creative and innovative at that particular time as a leader, because everybody is looking at you for answers. But I'm also looking at somebody else, the policymakers, to say, what are the answers? And when you're listening to the news, people have no answers, they have no vaccinations, there's shortages of the PPEs, we're not manufacturing, we have to bring them out of the country. We have to clear those and come up with strategies for clearing those things to come into. So in low-income countries, the situation was not easy. And innovativeness and collaboration was very critical. But in the end, we ended up now also joining the government technical working group, where we're also advising in terms of how best we can work together to make sure that a lot of people don't die. So with God's blessing, we were expecting the worst in the country, but we were spared, maybe through our faith or beliefs or whatever happened. And we said, Africa people were supposed to die because we didn't have resources. But we managed to contain that through collaborative and agility in terms of reaching out to those who have something and those who are willing to actually push resources into our country. So our lives were saved, although we lost a few people, but it wasn't a calamity or a national calamity, but we managed to contain through consultation amongst ourselves as churches, as CHARs, and also as health providers in the country, working with government and sitting in their forums in terms of creating policies for dissemination. So communication became very vital, collaboration and innovativeness. Thank you.
Thank you, Justin.
Do you mind repeating the question again?
Yeah, it's about agility.
Okay.
So, how were we agile? Is there, if we had insisted on business as usual, would we be here today?
No.
In your organization, is there an example?
Sure.
You talked about the task force.
My first one was the task force. So I have three other quick ones that, upon reflection, I think were pretty helpful for our organization to get through. You just mentioned communication. And as leaders, one of the most important things we do is communicate. And it's also whom we're communicating what message to with what frequency and how often, right? Or how often. And so I would encourage anybody who is trying to manage through a crisis or some sort of difficult time to establish a simple framework where you're identifying who your key stakeholders are. So key stakeholders could be your board of directors, it could be your management team, it could be the hospital staff, it could be the community, church leaders, however, who those stakeholders are, and then how often you need to speak with them and what messages they need to hear. So you can kind of picture a spreadsheet, right? So you have stakeholders on one side, and then you have messaging on the top, and then you have frequency in the middle, because people need to hear messages different ways from different people at different times in order to be effective in your communication. So crisis communication is really important, and there's very practical ways to do it, like I just explained, where you don't want to miss someone, but you also don't want to make homogenous messages to everybody across the organization because they receive them differently. So that was an important thing we did. We took, the second one I wanted to mention was we took a posture of supporting our staff and making quick decisions. And I think when we create bureaucracy within our organizations, it really frustrates people who are frontline workers and they need decisions to be made quickly. And so it would come in that, one of the hospitals would need N95 masks. Okay, so great, we tried to figure out where we would source those from. Another one had some PCR testing needs, and we were trying to figure out how we could do that. And we had a COVID outbreak in one of the operating rooms, so you needed to shut down that team and then do the whole sterilization of that room. And so everybody had a unique decision that needed to be made quickly. And if we were bureaucratic in how we made those decisions, and it needs to go to a committee and all this kind of stuff. And I think it would have been very frustrating to the frontline workers that their needs weren't being met and weren't being met quickly. So I think a posture of service and making fast decisions is really important. And then the last one is sort of strange, but we've probably all heard the adage, you know who your friends are when the times are bad. It's not who your friends are when things are good, but you know who your friends are when times are bad. Organizations learn who they are when times are difficult, right? And we reflected upon the COVID period. In January, we brought a leadership team together. And one of the things we actually did was redefine our core values, because we learned a lot about ourselves during that process. And one of our new core values is faithfulness in prayer, which was really born out of our posture of praying for all of these things and watching God give us wisdom and discernment and grace as we work through them. So we have a new core value, and it's called faithfulness in prayer, but it's really born out of a very difficult time that now is part of who we are moving forward.
Great. Thank you. Thank you all. I heard humility in everything they said, and that was one of the first questions Mark asked yesterday at the first session yesterday morning. But as we're reaching the end of this conference, we've talked a lot about hope and humility. Do you have a practical tool, a discipline, or maybe a Bible verse that you want to share that helps you cope when things are tough? Or is there something that you love to do with your teams in these tough times? Justin, we'll start with you this time.
Sure. These are super practical. So here we go. Okay. So the main thing that I try to do with regular frequency is really basic, but it's really important to the people that we work with. It's handwritten thank you notes. Have you guys ever heard of these things? Okay. So these things, there's a piece of paper, you handwrite it, and you would be amazed at how important these things are to people. First, that you thought of them. Second, that you wrote it out. And third, that you delivered it to people. So one of my huge encouragements whenever I'm talking about these types of things is take a moment to write a handwritten thank you note once a day. Sometimes it's to a donor. Sometimes it's to a board member. Sometimes it's to a staff member who's done something exceptional. And if you're really generous, throw a $5 coffee card in there. And, all of a sudden, everybody's loving life. So I think recognizing people is super important. And it keeps you humble because you realize you can't really do this by yourself. Another phrase that I use, it's probably not in the Bible, but it's this phrase of, you're not really that great. And I think we all try to believe these things about ourselves. We're put in positions that sometimes we don't earn or deserve. And you wonder how many people would hold you in leadership if they really knew you. And all of us have been through trials and difficult times that not everybody knows about. But if people really knew me, I think they'd know I'm really not that great. And I just have to remind myself of that because it's pretty easy to believe lies about who we think we are.
Yeah, there may be a couple people in here I don't want talking about that know me too well. V, you have a practical tool, a Bible verse, or a discipline that you use?
It's in my signature for my email address. It's Timothy 2, verses 1 to 7. And I'll quote, it says, "For the Spirit of God does not make us timid, but gives us power, love, and discipline." So when it comes to humility, I think discipline is very important. And also knowing the word of God that we are there for the people, because I am where I am today. It's not by choice. I believe that God put me there. I was working with the Ministry of Health as an undersecretary, and I just felt bored pushing paper. Then I saw a job which was being advertised, and I was like, let me try it. I thought it was a consultancy job because I like consultancy work. Then I got the job, got an interview, and it was a church organization. And I remember when I was leaving the ministry, people were saying, "Are you sure you want to work for a church organization? There's no money there. So I was like, well, I've made a decision. I can't be pushing paper and I'm not making a good impact because I'm not satisfied. So when I got the job, there was nothing. There was no money. And I panicked. And I had little kids going to school. And I remember I had a fight with my husband to say, why did you leave a job and you're going there? I said, where God put me, I'll make a way. So I worked hard. And 20 years from that time, with nothing, here I am working for an organization which has grown big and so forth. So God put me there. That's how I feel very humble in approaching my work. And during the COVID time also, we felt that there was a need to make sure that people are happy, are comfortable, are supported. We have counseling. So with the executive, we decided to hold hands together. And we know that people were dying in their families. I had people dying in my family. And our health workers had people dying in their family. So we sent messages. We supported those who did not have enough resources. And sometimes people couldn't go and bury their own, but we would sit in the offices and discuss issues to say how can we help each other to come through this process. Some people didn't have enough food and so forth. So as an organization, we just mobilize ourselves to actually support the families. And then when people died, we used to, working with my PA, we made it a point that we send condolences messages to the families so that at least the staff feel we are embracing them, they are not alone. Because those were the very difficult times where you look at your workforce, they are dying. Some of our staff died. Some lost children, husbands, breadwinners, and things like that. So we said, how best can we support each other? We couldn't visit each other. We couldn't go and cry together or go for funerals. But we thought if we interacted amongst ourselves and sent condolences messages, and encourage each other and counsel each other, it was best that way. So that's how humility works. And even today, like you lost very dynamic staff and you can't replace them, but we remember them. So once in a while we pray about that. And also we pray that God has given us the opportunity to move on. We survived, so we're moving on. We have a story to tell. And I think that's the humility we have. Even working with government now, we are encouraging that we should not be criticizing each other. We should be working with each other and supporting each other. And we have that relationship in terms of supporting staff as well. So it's tough. It's not over. There's post-COVID. Some people are still grieving. So if you have lost somebody, it's continuous. That memory is there forever and ever. So it makes you humble.
Yes.
Thank you.
Thank you. Father John, and then we want to get a couple of questions in, I think. So.
Yeah, as both of my friends said, there is no better tool than a word of God, which actually motivates us. So before disclosing the Bible verse, I should say why it came to me. As I said, we had nearly 1,000 patients at a time in the hospital, COVID-infected patients. And then we were struggling to manage the situation. So I kept on praying, God, make it at least 100, 500, so that I can manage easily. So the numbers, I was bargaining with God every day to bring it down. Because my concern was that all these 1,000 patients should be given food, all meals should be served, and my staff should be provided food. There are nearly 3,000 staff. Many of the doctors and nurses could not go home back because their neighbors would not accept them coming to their neighborhood. So there were so many challenges like that. My drivers should not fall sick, then transportation becomes a problem. My cooks should not fall sick, then the entire campus will not have food. So a lot of challenges like that. In between, I lost 2 staff, of course, maybe by their mistakes and so on. Otherwise, none of our staff were affected. So in this dialogue with God, always one verse came to my mind that was from the Acts of the Apostles, chapter 10, verse 38, which says, Peter says about Jesus that Jesus went about doing good. preaching gospel and healing people, and God was with him. So it came to me again and again, and I felt that is the call actually. Go around doing good, meet people, motivate them, give an assurance that the management is with them so that they would do everything. And it really worked. I was also myself infected by COVID. I was in isolation for about 14 days. When I came out, I had difficulty in breathing and walking and so on, but still I didn't give up. My friends also were doing the same thing. I lost my father due to COVID, but still we never gave up. We kept on visiting people, encouraging them to do the work and so on. So it worked like that. One fine day, early morning, my maintenance manager called and said, we have oxygen left only for 3 hours. I just asked him how many patients are on oxygen. 500 patients. What to do? We checked with the government to support us. They said, no, that's none of our job. You have to get it. So we approached the companies. They said, no, there are many hospitals waiting. How can we give you priority? Somehow we used our all contacts possible and got them to give us oxygen, and then we got the police to pilot our vehicle, and just an hour before the oxygen got emptied, it was offloaded to our systems. To my surprise, actually we could say God will be with us and our labor will never be in vain.
So don't be timid and write thank you notes, because God is with us. Do we have time for questions? Anyone have a question for the panel?
Are you here?
Just barely persevered.
Good afternoon. So it's not a question. I missed the verse from the doctor. I didn't get the verse that you said.
Acts of the Apostles 10:38.
Acts 10:38.
Thank you.
Maybe while I ponder a question, so what have you done to, since then, to celebrate with your staff, but also to give them time for pause as a way of self-care and bolstering for the next trial?
Okay, so what we did for the staff was to give them good food and a lot of music in the dining hall so that they would talk less, because the loud music is there. They would enjoy the music. We didn't want them to open their mouth and spread the infection because they come from the service point. So loudest music so that they would enjoy the music but never talk much. And in the front of their hostels, we kept eggs, milk, and all other possible snacks and so on. For the task force, there was separate room where all sorts of fridge and all refreshment items were kept there and so on. So that was one thing which we could do. And we had the security guards going around and making sure that no gatherings happening. At the same time, when they come out of the duty from the PPE, they are fully sweat and they are totally exhausted. So there should be somebody to say hello to them and you did a good job and give them a cup of juice.
From my end, I think we did the different. From the main office, it was our first time to let people go and work home, to say work from their home, because it's not a culture in Africa for people to work from home. So our worry was, are they going to deliver or they're not going to deliver? Because the partners expected us to deliver regardless of the situation. So we let them work at home, and we never really made a fuss. All we wanted was maybe to deliver and just monitor them. So it was a new thing for us, and it also made us realize whether staff can be relied upon in terms of work. So my fears But when we let them to work at home, we're so flexible. So we didn't really put strict time. So that was the issue. Then for the mission hospitals, which are in the rural areas, we didn't have a lot of major cases in the rural areas, but we made sure that people were given food at the hospital because they worked hours diligently and they were dedicated. They never complained. And we made sure that if any of their families got sick, they didn't have to pay anything at that particular time for anything. So we said there's free medication, whether it was related to COVID or not. We said let people be treated for free. But sometimes the churches would say otherwise because you don't own those hospitals, they are owned by the churches. But those who had our plea, they went ahead and supported the health workers. Also, in terms of management, because we're working around the clock, also the partners that we deliver, we had to now talk to our partners to say, can't you be flexible in terms of the demand? Because sometimes you can't go out. So let's revise some of the requirements you need. We report on what we can, and then the others we can then follow through. So it was difficult to really make them relax totally because work had to be done. People had to come to the hospital. Some clients would come and knock on our doors. Medication was in short supply. So we became, we said, let's be innovative. And we also reached out to the private sector where they then could give us some freebies once in a while, but it was not all of them because they're also looking at their income in terms of loss. So it didn't become as easy as that for us. Reality was there, and that's how life was. Thank you.
Anything to add, Justin?
We gave them a bonus.
Gave them a bonus. That's, yes.
Yes, I can, yeah. So I wanted to ask, as leaders of your organizations, what spiritual practices did you engage in to keep yourself persevering? Was it things like solitude and silence or anything like that?
Real quick for me, I really focused on journaling during that time. So a prayer journal, and then I went on a lot of walks.
Exactly the same thing. Our campus is 150 acres campus. We have enough space there. So although we had restrictions outside the campus, it was free campus for us. So in the evenings, we used to make long walk around the campus, reflecting on what we are doing, where we are missing things, what could be done for the next day. Walking solved many problems, gave us more insight also.
You know, I wasn't in the space that they were, but I put it on my calendar that I needed to have time for prayer and mindfulness every day, even here, not dealing with all the things they do. It remains there today as a reminder every day. Karen.
Thank you. Thank you very much for that presentation. And I think we were all confronted with a lot of challenges. I haven't heard any one of you speak about vaccinations, COVID vaccination. I know that in our region, it became a bone of contention, and that a lot of people didn't want to take vaccinations, particularly from the religious groups, that they believed that this was a mark of the beast and the 666. And for me, one of the things that I was really confronted with as a leader was that, I needed to take a vaccine. To be a leader, I needed to be one of those people that demonstrated that the vaccine was okay. So I was the number 3 person in the country. There was the minister, PS, and myself, the first 3 people who took the vaccine. But it was difficult. So I want to hear, what challenges you faced in trying to convince people, or what you did personally in trying to convince people that the vaccine was okay, particularly to V, my twin sister, who, in our region, it was difficult to convince people. So what did you do about the vaccine?
you, Karen, for bringing that up. True, vaccine were difficult. First of all, we didn't know what vaccine we're going to get. Because globally, there was maybe competition, I don't know what to call it, to say which vaccine should be produced, Pfizer, Sinopharm, whatever. So, yes, Johnson & Johnson and so forth. So we waited for our leadership in terms of governments to say which vaccine we're going to receive. So we are Sinopharm, and they say Sinopharm, others say Sinopharm. So that's the vaccine which they chose. So yes, as you are saying, we have to deal with a lot of religious issues in terms of the belief for taking the vaccine, and also there were myths from social media and so forth. So we then had to confront government to say maybe we need to send clear messages, like a singular message as a country, so at least to avoid people coming up with their own messages. So the vaccination came as Sinopharm, and people didn't want to take it, including health workers. And we're hoping that the health workers will be the first one to accept it. And then once they accept, everybody will agree. So people are saying, oh, these are trials. You are making us scapegoats and things like that. So yes, as you are saying, as a leader, you have to lead by example. So we did go and get vaccinated. I talked to my executive to say, let's get vaccinated. So we went for our first vaccination, and they were going to say that maybe there are some side effects, because some of them were expecting side effects. But I didn't have any side effects, and my team didn't have any side effects. So we're like, where is this coming from? But even the health workers, some of them were sending the wrong messages to the patients. But eventually, government put a policy to say at least we should have a first dose. So we did have a first dose. But with apostolic faith, which are not secular church leaders, they worship under trees and so forth, and they don't believe in any treatment from the hospital. They believe you can be prayed for and you are healed. So that's another sector which we did. But we work with a group called Judas Caesar, which coordinates that. So we managed to also get some people vaccinated, but not of them. So yes, we had health workers who are not vaccinated, and some of them, we started now taking registers. We created a register to say we wanted to know how many people are vaccinated, and then also to say, if you're not vaccinated, you're not going to come to the office. You can work from home, because we don't want to infect others, because the rights issues were coming into play also. To say, if you're not vaccinated, you come to work, you infect me, and you need to protect others who have not been vaccinated. So we kept a register for people who are vaccinated. So we did vaccinate everyone in the office, but a few didn't. And we couldn't force them because they had their own beliefs, because we are different denominations at work, and people have different cultures and beliefs. So we just left them to them. But as things eased off, we agreed that they can come to work. We wear masks and so forth. So we're not, even if you look at the statistics for the country now, the first dose, people have been vaccinated. Second dose, third dose is still low. So with the Africa CDC, we're now trying to scale up vaccination, but the uptake is more on children as well. So the challenge is still there. And I talked about issues of equity also, because some people thought that these drugs are being dumped to Africa because they're not working. They don't want them in Europe, because why is Europe using Pfizer and Africa is given these other Sinopharm? For our country, they thought it was like the cheapest drugs of all, because of where it's coming from, because those are what people believed. But then the Johnson & Johnson in South Africa, it rejected it, and they wanted to push it into our country, but we also rejected it, but other countries took it. But now, those who took Johnson & Johnson, the single dose, we feel that they are better off. We refused it, but now we're struggling with the 1, 2, and third dose. So the single dose was the main answer. And for us to be above 70% of the WHO is now a challenge. But for those who took the single dose, they are done. So it's issues of policy, choice, and so forth. Thank you.
Justin, anything to add about what you did about vaccines?
I generally avoid talking about vaccines.
Yeah, Father John.
Actually, we didn't have much of challenges about the vaccine. Initially, the availability was a question. We had only vaccine coming from Pfizer. Then by the time India also made vaccine, from Serum Institute, they made Covishield available. And initially, the government launched it only for the healthcare workers. So that phase one really helped us a lot because doctors, nurses, all healthcare workers were taking vaccine. And that gave a positive message to the people that vaccines could be taken. There's no danger in taking that. But still there were some apprehension. Some people had reservations and so on. But generally the voice of the people were in favor of that. And because many of those who had no challenges, no health issues, generally people accepted that. But as she rightly said, the situation for the second was also same. The numbers were very less, and for the third dose, the numbers were very, very nominal. But we had a tough time because we had to pay the full amount and buy it and then make it available. So we got in large numbers, kept it ready, and then by the second dose came, the government announced everything free of cost. And then we lost some money also on that. But still we made it available for the people there, and then people at general accepted vaccines. There were no issues. Mostly the social leaders, politicians, even church leaders, all of them came forward, and that spread the message that it could be taken.
Thank you all. I think our time is up. Please join me in thanking this panel. And I've taken something from HAP. They call it their parting shot in their newsletter. And the one that was in the recent newsletter said, "We live in a world that is constantly evolving. Staying relevant in today's global scene requires organizations to be innovative and adaptive. The only way to keep up is to never stop learning. There is a lot to be learned through interacting with others. Knowledge sharing should be a priority for organizations to support the continuous process of learning and challenge people to expand their skills." I think that's what's happened here today. I want to thank this panel again for taking part in that. I want to thank CCIH for bringing all of us together. And thank you. And Doug, I'll turn it back over to you.
Thank you. Thanks, Bruce. Mona, are you not doing your plenary selfie?
Oh my gosh, I'm sorry.
She would regret, if I hadn't done this, she would be regretting this. The universe would be out of balance. Wow. Okay. Well, we are down to the final last couple of words, and I just have a few things to say. First off, I'll just a couple of announcement things. There's still some materials on the back table. Please take them, because wherever you're going to, you've got somebody that you can share them with, even if you've got one for yourself for your own stacks. Second, in the snack area back there are a bunch of uneaten snacks, and so feel free, go load up and take some with you if you like. Be free. So those are a couple of things. Is that somebody rushing to get their snacks? Deirdre, you can. Tomorrow we do have the Hill briefing on advocacy, and that will be in Russell Senate Office Building, room 385 at 11 a.m. I think we've got room for how many people, Bob? Would you? Some. 20. Okay, there you go, 20. So if you are free, that would be a great way to spend some time. You would learn a lot. You would be able to lend your voice to the process tomorrow. So see this guy here if you need some more directions about that tomorrow. But otherwise, 11 a.m. tomorrow morning. I want to take you back just for a moment, just to remember where we've come in the past couple of days. It feels already like, gosh, that was, so Monday, so many days ago, when we started with our 2 pre-conference sessions in the day, and then had our opening plenary in the evening with our greetings from Senator Rubio, and then Atul Gawande, the greeting from Koki Agarwal, and then that wow panel on localization with Karen Sichinga, Adam Phillips, moderated by Kate Onyejekwe. Somebody said to me afterward that they were surprised that plenary got into tough issues. And we realized afterward, we never told you that we set it up that way. We actually gave full permission, and we checked with Adam to make sure that he wasn't going to feel awkward if hard questions were coming at him. Such is the level of confidence that he had that this would be a productive conversation. So Karen, you're the one still in the room right now. Thank you for the hard questions and leading that. But there could be a lot more said, and tomorrow's localization briefing will touch on some more of those issues. My inbox is still not full of your opinions and thoughts on this matter. So please send me your thoughts. I would love to hear additional insights and questions and concerns and suggestions. Through it all, I'm listening for what we can do and what voice we can contribute to it. Day 2 yesterday was dealing with things that don't go as we hoped, and a lot of humility that's necessary to get into that. There's a couple of key words that stood out. I was thinking about yesterday's plenary and the idea of giving ourselves permission to fail. Now, there was some rub on that. Can our donors allow that? And what does that really mean? But that culture that we create where it's okay for us to make mistakes. I like to say within CCIH, guys, tell them if I'm lying here. I like to say that I'm the chief mistake maker. Okay? Thank you. It's true that I say that, or is it true that I am that, Carolyn? Thank you for that. We'll talk later. But that's, I love in the IT field, they've got a phrase, and when you're building software, they say, fail fast. That's their whole phrase is, I'm getting, by the way, my watch is telling me that I'm very physically active right now, so I'm very happy about that. But they say fail fast because it's assumed that you're going to make mistakes or things are going to fail. So do it quickly. Do it quickly. Figure out what doesn't work quickly so that you can get to doing things right. And I think that there's a bit of that. But then as leaders, we have to also really create that culture of permitting failure. It isn't a competition to say that I'm the chief mistake maker, but I think it's one of those things that we all have to really embrace. Day 3, perseverance. I love this whole conversation that was happening here. And especially these concepts of agility, flexing. Don't hold to things too tightly. Flex and adapt, because otherwise, if you don't flex and the storms come, you break. So I think there's real wisdom in that. But I want to highlight one thing. I was in one of the breakouts this morning, and I won't say who said it, but there was a word that was said. There was a question about a difficult issue. And the question was, how do you deal with this difficult issue? And the person paused for a second, looked down, and said, it's complicated. And I thought, that's it. That's what all of us are dealing with every day. If this stuff was easy, then I don't know. We wouldn't be here trying to figure out how to support each other. It's not easy. It is complicated. We do struggle at times. Sometimes things just don't make sense, and you have to figure out how to make sense out of it. It's complex. And that takes me back to the last thing that I want to say about this before I thank a bunch of people. It's right there, look, the logo. Hannah, when you developed the logo, you didn't know how much of an impact that would actually have on me. Take a look at that for a minute, and the heartbeat with the cross on it. And what that symbolizes to me, I'm sure you have different things that it symbolizes to you, but it symbolizes regular rhythm. It's a regular rhythm. It's a heartbeat. It's life. And it's all in Christ. And that's what we do. We live, we work, we communicate, we share, we email, we bear each other's burdens, we press each other. It's the regular rhythm of this work. We meet, we separate. It's the regular rhythm of this work, all in the name of Christ. And I'm so delighted to work in a place like CCIH where we can actually say that. That rhythm, manifested by that logo, brings together all of these elements of hope and health, hope in health, of humility, of perseverance. So I just want to leave you with that as you stare at that. And now, the last thing that I have to do today is to thank, and really, really thank a lot of people for making this all possible. I'm grateful to Catholic University. You know, we started in 2019 thinking we were going to come here. 2020, well, 2021, well, 2022, well, 2023, woo! And they've really been pretty amazing to work with. They've been very patient and tolerant as we've had many, many questions that have changed over time. It's been great to do that. I'm grateful to our conference planning committee. So who in this room has been part of the conference planning committee? Stand up. Not everybody's here, but it's on page 4. Laura Berry, Tom Davenport, Dick Day, Mazi Fanjo, Mike Ida, Josh Korn, Full Marine, Henry Mosley, Janet Opio, Chris Panico, Chris Pranger, Simon Santongo, Nancy Tenbrook, me, Mona, Kathy, Hannah, May. We'll get to us in a minute. But those are the people that made this work. These were meetings that started. When did we start, Mona? Where's Mona? August of last year. That's how soon we started on thinking of how to pull all of this together. We also are grateful for the World Face Development Dialogue, the Dalton Foundation, and many individuals for their sponsorship of scholarships that made it possible for people to be here. Along that same line, we're grateful for our sponsors. We've already said that, but I think you've had a great chance to interact with them in a very public space out there. I'm grateful for our presenters. From our plenary presenters to our breakouts, please, claps to all of them. Because they're the meat, they're the thing that brings us together, that actually causes us to have something to discuss. And that I've learned so much from each of these sessions. Grateful for that. I'm grateful for the worship team. That was pretty amazing. Mona, thank you for your friend that you connected with this, but that was a meaningful time of worship. Grateful to our volunteers. There are quite a number of volunteers who have helped us, and I'm not going to name them all. I'm not sure that I've even got the list of all of them, but there were the official volunteers, and then there were other volunteers who jumped in to help out. If you were a volunteer or felt that you were a volunteer at some point, stand up. Stand up. You see what it takes. You know, after I botched the introduction to Ambassador Nkengasong's video, I sat down next to Bob, and my comment as the video was starting up was, whoops, and Bob just said, it takes a team. He said it takes a team. So I am thankful for the team of CCIH. Friends, I work with the most amazing set of people. I'm going to start, not in any particular order, but Deirdre and Carolyn, you guys are part of the program team. You're part of the thinking that goes into our global health work, and that's fantastic, the role that you play. Rena, actually stand up so that they can really see you guys. Okay, good. Bob, who leads advocacy. Bob, stand up. Helping out with everything. Rena, are you in the room, Rena? I can't see you. Where? Well, there you are. Who manages all things finance and administration. These folks are just part of the glue of keeping CCIH going. The conference team picked up a little bit more energy with several of the people. Hannah, you are hiding behind the white banner. Come around here so the people can see. All design and creative work and managing numerous communications pieces, all of that was on Hannah's broad shoulders, and so we're grateful for that. May Podushnik, where are you? Thank you. May has filled in a really vital role for us on membership management, but she has handled all the logistics, all of the planning that goes into the facilities, all of the difficult and easy things that go in with working with a university like this. She's been the one to have to manage that. And really done a great job. First in-person conference, and she's really had to step up to that. So thank you, May, for outstanding work on that. Have I forgotten anybody? There might be, oh, Kathy! Kathy, Herb, come forward, please. You know, for every single thing behind the scenes, you know, from printed programs and pull-up banners and all of that, but also all of the comm stuff. You know, she's been actually back here managing our Zoom interface for all of our online people. Kathy's actually the person who's directed and led all of that, and she's one of two of the directors of CCIH on the team. We're grateful for everything that you've done. Thank you, Kathy. Do we have a cruise ship director in the audience? This, I don't know, I think we've been coming to these CCH conferences long enough to know Mona's joy and vibrance that comes out in these conferences, and we're grateful for that. But what you don't know is when she says that this started back in August, you don't know the hours and hours and hours that it takes for her to think through a program, construct something, bring together something, balance and make sure every single panel has got diversity, make sure that every single subject matter is covered, make sure that all of the different topics that we need to bring out are actually brought out. That takes immense work and planning, Mona. And you have been able to manage all of that. We are so grateful for what you've done. So please stand up. I could not do this work without this team, and I'm really sincere about that. So on behalf of the board, on behalf of the staff, have I missed anything? Did I forget anything? Have I covered? Yay me.
That's the last slide. We're good.
Thank you. That's the last slide, I'm reliably told. So with that, on behalf of the board and the staff of CCIH, thank you for coming. Go home.